Good day everyone, I'm John Allen Ambistaho and today I'm going to perform a return demonstration on head-to-toe assessment. Starting with the preparatory phase is first is you're going to assess the patient's previous medical records if available. So here is the patient's medical records, and next is you're going to determine the scope of assessment needed and also the prepare na necessary equipment that is going to be needed later on to the assessment. So here are my equipments. Then next is I'm going to perform hand washing and don gloves if deemed necessary. So instead of hand washing, I'm going to perform hand hygiene and I'm going to use alcohol-based hand rub. This is to avoid the spread of microorganisms. So after performing hand washing or hand hygiene, you're going to gather the supplies or equipments needed. So I already did, and this is for organization of work, and it will smoothen the procedure of the assessment. The next is you're going to introduce yourself to the client, and after that you're going to identify the clients or verify the client's identity so that the right patient will be assessed with the right assessment. So good day, sir. I'm John Allen Andistao. I'm your student nurse for today. And may I know your name, sir?
June Mark Malacatones.
Okay. Your birth date?
June 25, 2006.
Okay. Your age?
15.
Your religion?
Roman Catholic.
Okay, thank you, sir. So after that, you're going to explain the procedure to the client. So today, sir, is we're going to assess your overall body, which is from head to toe. So we're going to assess that. We're going to test your hearing, your taste, your sense of smell, your sense of touch, your sensations. So all the 5 senses, we're going to test that. So are you ready, sir? Basin gusto pa ka manghihi, sir, or do you want to urinate or drink some water? Are you good to go?
Yes.
Okay. So next is you're going to position the patient comfortably and provide privacy. So assuming that we are in a hospital setting, you're going to close all the curtains as well as the room and the door. As well as the door of the room and the windows, you're going to close that. So this will keep the patient at ease. So are you comfortable with your position, sir?
Yes, nurse.
Okay. So moving on to the assessment phase is first the general survey. So you're going to observe the client's appearance and you're going to assess vital signs, take the body measurements, and by that you're going to measure all these waist, hip, and as well as the height and the weight. So starting with we're going to observe the client's appearance. So okay. Okay. The next, we're going to assess your vital signs, sir. So prior to taking vital sign, first we're going to perform we're going to get your temperature. So here is a thermometer. So I'm going to get your temperature, sir. Okay. So the patient's temperature is 36.5, which is normal. So the next is we're going to check the pulse. So I'm going to check your pulse, sir. So also we're going to check your respiratory rate. Normally the client's normally the client's breath per minute is 14, which is normal. Then we're going to check your blood pressure. Parang sir, mag-check ko sa inyong blood pressure. Guot ra sir, tama lang. Yun lang, guot lang sir ha.
Okay na.
Ito ang i-adjust. Guot. Sakto lang.
Sakto lang.
Okay. Straight lang sir. Sige sir. Okay. So, in blood pressure, normally the client's blood pressure is 110 over 80 millimeters of mercury. So, that is also the findings of our patient. So, next is we're going to test for the pain and the sensation of pain. So lately, sir, have you been feeling any pain or discomfort in your body, sir? Wala ba kayo na murag asa dapit kung sakit ba imulawas or kaan?
Wala na.
So wala kay mga kanang kasakitan nga sensation sa imulawas. Okay, very good. The next is we're going to take the body measurement of our patient. So magtimbang lang ta dito, sir. Dito, sir. Okay. We measured your height, sir. It is 162 centimeters. Then your weight is 50 kilograms, as well as your waist circumference is 26 centimeters, and then your hips is 35 inches. So in calculating your BMI, we had your BMI is 19.1, which is normal at your age, since you are still 15 years old. Then we're going to get your tricep skin fold thickness. Okay, sir. Now I just want you to The next is we're going to assess your mental status, sir. So in this mental examination, I'm going to observe your level of consciousness, so observe posture and body movements, facial expressions, speech, mood, feelings and expressions, thought processes, and perceptions. So prior to that, I'm going to ask the client some questions. So, so tell me again your name, sir.
June Mark Colocatones.
Okay. Uh, then, so where do you live, sir?
Proco, Nabogak. District, Makabe, Bislig City.
Okay. So normally the client is conscious and alert and at the same time awake. So in the posture and so the client appears to be relaxed and normally the client is able to move every part of the body freely. So we're going to test that. So I want you to stand, sir. Then I want you to walk a little bit, sir, starting from here to there. Sige, sir. Ako, sir. Then again, balik dari. Ano nga ito mo? Again. Okay. You may now sit down, sir. So normally the client is able to move every inch of his body freely and can stand, sit and turn and lay down properly. So in facial expression, so the client maintains eye contact when I interviewed him, and then in speech and I'm going to observe the client's tone, clarify, and the pace of his speech. So what are answer? What are your goals in life, sir? What do you want to become?
Gusto ko may mag-police na.
Okay. And nganong gusto makamahimog pulis, sir?
Katabang sa sigkatao o madakpo ng mga bad guys.
Okay. So next is I'm going to assess your cognitive abilities. So do you know the date today, sir?
August 3, Tuesday.
So where are you today, sir?
In your clinic nurse.
Okay. Now, sir, is I want you to get this pen, sir. Then you're going to hand it over to me. Okay, very good. Then I want you to put it back where it came from. Okay, very good. So, what was your, do you remember your breakfast today, sir?
Yes, nurse.
What was your breakfast?
Egg and hot dog.
Okay. Now, sir, I'm going to ask you a question, okay? So, what is the difference between a apple and a mango? I mean, what is the similarities o unsa man ang ilang kaparihan?
Pareha sila prutas.
Okay, then unsa may difference sa ila, unsa may nakalay sa ila?
Ilang color o ilang texture.
Okay, very good. And then now, sir, is I want you to draw a clock. Okay, so I provided a piece of paper here. I want you to draw me a clock, sir. Okay. Okay, very good. So, normally, the client is responsive. He draw what I instructed him to draw, and then in judgment. So what do you do if you will feel pain, sir? Kung masakit ka, kung bation ka kuan, kanang sakit. Unsa may imo buhaton, sir?
Mag-hydrate, mag-relax, o mag-stay sa balay.
Okay. Then, moving on to the physical assessment on the skin, starting with the skin, we're going to assess the skin color, variations, texture, temperature, and trigger, edema, and lesions. Okay, sir, I'm going to check for any lesions or rashes in your skin. So I want you to relax, sir. Okay, sir. Okay. And I'm also going to check for your temperature, sir. Hold my hand, sir. I'm checking for any bulges and as well as for any tenderness. Next, sir, is we're going to assess your head and face. So I'm going to inspect and palpate for the head size, shape, and configuration. So I want you to look at me now, sir. Okay, okay. Look this way, sir. So extend your sir. No, no, sir. You need to palpate your head. Okay. Next, sir, is I'm going to note for consistency, distribution, and color of hair. So I'm going to remove this, sir, first. Yes, sir. Okay. Sir, that's sir. Head band. So next is I'm going to observe for symmetry, facial features, expressions, and skin condition. So I'm going to check for the cranial nerve 7. So I want you to smile, sir, without showing your teeth. Smile, sir. Give a wide smile. Then I want you to show me your teeth and blow out your cheeks. Raise your eyebrows. Frown. And I want you to tightly close your eyes while I put some resistance. Mr. Pugni, sir. Okay, very good. So next, sir, is I'm going to evaluate the function of your cranial nerve 5. So I'm going to use sharp and dull sides of a paper clip, and I want you to tell me if where the what side or what edge of the paper clip is I'm using, if it's a dull, if it's the dull side or the sharp side. Okay,
Finish.
so I want you to close your eye.
Sharp. Dot. Sharp. Sharp. Dot.
Now, sir, is I want you to point where I put the paper clip kung asa na ako gitudlo, sir, ang paper clip. Imo po di at the same time imo ingon kung sharp pa siya, tapos imo itudlo kung asa na ako gi touch, okay?
Okay na.
Sige.
Sharp.
Asa madapit? Okay. Close your eyes again. Madapit. Okay.
Sharp.
Madapit. Okay, very good. And then I'm going to palpate your temporal arteries for elasticity and tenderness. So I want you to relax lang, sir, while I'll palpate your temporal arteries. Okay, there are no tenderness and elasticity present. So next, sir, is I'm going to palpate the temporomandibular joint for tenderness, swelling, and as well as crepitation. Okay. Now, sir, is I want you to open your mouth, then close. Again, open your mouth, then close. Okay. Open your mouth, sir, wide. Okay, close. Good. Then next, we're going to assess your eyes. So I'm going to determine the function of the following. So we're going to test your vision using a Snellen chart, and we're going to test visual fields. We're going to assess the corneal light, and we're going to perform cover and position test. Okay. Then so now we're going to test your vision using a Snellen test. So now, sir, I want you to look at that Snellen chart over there. Okay, sir, read that line, the lower line.
DAFBOTEC.
Okay, very good. So your vision is 20/20. And next is we're going to test your visual fields. So now, sir, is I want you to stand, sir. And then stand there, sir. Then I want you to face me, sir, towards me. Then cover your right eye. Cover your right eye. Your right. Okay. Now I want you to follow my finger, okay? Okay. Follow lang, sir. Tanaw lang. Oh, sige. Without moving your hands. Okay, on the other eye. Okay, follow my finger. Okay. You may sit down, sir. So next, sir, is I'm going to I want you to tell me, sir, if makita na ba nimo ang akong finger, okay?
Yes.
I want you to look straight at me, okay?
Kita na.
Again. Okay. So, no irregularities was noted in regards of his eye and vision. So now we're going to assess your corneal light. So I want so assuming that this is a pen light, I'm going to use this in assessing the corneal eye of our patient. So now, sir, is I want you to look that way, sir, and don't stare at the light, okay?
Okay, nurse.
And then we're going to perform cover and position test. So I want you, sir, to look at this pen, and then I'm going to I want you to look at that wall over there again. So first matalo sa kadiri din dito, okay?
Okay, nurse.
Sige, tanaw sa pen. Dito. There is a pen. Dito. Okay, very good. Then next is I'm going to inspect your external eye. So, okay, sir, I want you to look at that wall, sir. I want you to look up, sir. Okay. Pause aliman. So your eyes are normally aligned in the eye socket. Then I'm going to check for the bulbar conjunctiva, so which is the upper eyelid, and I already did with the and the sclera. So the bulbar conjunctiva is moist, smooth, clear, and no signs of conjunctivitis. So again, sir, we're going to inspect for bulbar conjunctiva and sclera, as well as the palpebral conjunctiva, lacrimal apparatus, and corneal lens, iris, and pupil. Okay, sir. Look up, sir. Okay. So I am looking for any tenderness and swelling. Okay. Next is we're going to test papillary reaction to light, and we're going to test for accumulation of pupils afterwards. So again, sir, I want you to look at that way, sir. Okay. And I'm going to assess your corneal reflex using a wisp of cotton. We can assess the corneal reflex of the patient. So now, sir, is I want you to look at that way, sir. Tapos pataas, sir. Ito lang, sir. Taas lang, sir. Okay. Okay. On the other, dito na po, sir. Taas. Ihangad dito yung mata, sir. Okay. So client's eyelids blink bilaterally. So next is we're going to assess the ears. So we're going to inspect the auricle, trigos, and lobule for shape, possession, and lesions. Position, lesions, discolorations, and discharges. So I'm going to palpate your ears, sir. And then we're going to inspect your ears. Yes, sir, I'm going to use a pen light so that you can see it clearly. Okay. Next is I'm going to palpate the auricle and masnoid process for tenderness. So there is no tenderness present. Okay. Now we're going to test your hearing, sir. So I'm going to perform a whisper test, and I want you to tell me what number or what phrase is I whispered, okay?
Okay, nice.
Sige. Okay. And the other ear. Okay, very good. Then next is we're going to perform Weber's test. So, assuming that this is a tuning fork, so I want you to tell me, sir, if asa ang mas kusog or parihara ba ang voice or I mean ang sound sa inyong madunggan sa inyong duha ka ears, okay?
Okay, nice.
Okay, sir. Which is louder, sir, or same lang ba, sir? Kasi mas may mo pangdong sa vibration, sir.
Same.
In both ears.
Yes, nice.
Okay. Now we're going to perform the Renee's test. Okay, sir. Now I want you to tell me if do you feel any vibrations or sounds, okay? Then tell me if there is no more.
Okay, nice.
Sir?
Yes.
How about now?
Wala na, nice.
How about now? Okay. The other side. We hear the vibration.
Yes.
How about now?
Wala na, nice.
How about now? Okay, very good. The next is we're going to assess your nose and sinuses. So I'm going to inspect and palpate the external nose for color, shape, consistency, and tenderness. So sir, I'm going to palpate your nose. So so far there is no tenderness present. Okay. And we're going to check for patency of airflow through nostrils. So I'm going to turn up and light on you, sir. I want you to hyperextend your head, sir. At anong airflow sa imong kuan. Okay. Yes, sir. I want you to cover your one nostril. Then inhale. Exhale. Then on the other nostril foot. Inhale. Exhale. Okay. Now we're going to test the cranial nerve 1, which is the olfactory. So we're going to test your cranial nerve 1, sir. Now I want you to close your eyes, sir. Then cover your one nostril. Then I want you to identify, sir, if what object is your smelling. You're smelling, okay?
Perfume.
Okay, on the other nostril.
Alcohol.
Okay, very good. Then we're going to inspect for fluid or pus. So again, sir, I'm going to check for fluid in your nose. Sure. Okay. Then moving on to the mouth and throat, we're going to inspect your lips and consistency for color and lesions. So prior to that, you're going to wear gloves so that you will not contaminate your patient's mouth.
Excuse me.
So I'm going to check your lips, sir, for consistency or any tenderness, and as well as the color. So okay, then I'm going to inspect the teeth, the number and condition of your teeth. Okay, so I want you to open your mouth. So using a tongue blade, I'm going to check your mouth first. Okay. Okay. And then we're going to check the gums and buccal mucosa for color, consistency, as well as for any lesions. Yes, sir, open your mouth again. Okay. And then we're going to inspect the hard and soft palates for color and integrity. Okay. Close your mouth, sir. Then, and I'm going to ask you to say sir. We're going to check that. For the rise of your ovula. Okay, sir. Open your mouth and say ah. Again, sir. Iprolong. Okay, very good. And now we're going to test your cranial nerve 10, which is the gag reflex. So using a tongue blade, maka-feel ka kanang murag matuk-an ka gamay, sir, pero it's a normal response. Open your mouth, sir. Okay, okay. Now. Okay. And and also we're going to check your or inspect the tonsils for color, size, lesions, and exudates. So open your mouth again, sir. Tonsil. Relax imong tongue, sir. Then okay. Then next is I'm going to inspect your tongue, sir, for color, moisture, and texture. So I want you to stick out your tongue, sir. Okay.